Welcome to the Nurse Perspective, where we delve into the vital intersection of healthcare, community, and public health nursing practices. In each episode, we'll explore a wide range of topics, from preventative care and health promotion to disease management and community engagement. We'll have special guests talking about specific topics near and dear to their hearts, and individuals with lived experiences, shedding light on the challenges and successes of public health. Let's meet the team, starting with your host.
Hello, my name is Jacki Haley, RN, and I'm the Clinical Section Manager at Two Rivers Public Health Department, and I oversee nursing and all things clinical.
Hello, I'm Jordan Anderson, Public Health Nurse RN, and I am Team Lead on STIs and immunizations here at Two Rivers.
Hi, my name is Rosa Piñon, and I am a Public Health Nurse LPN here at Two Rivers Public Health Department, and my specialty is tuberculosis. I also speak fluent Spanish and English, so we are available if you need us.
Hello, I am Liz Weens. I'm a public health nurse, RN, and I am the lead nurse here at Two Rivers Public Health Department.
Hello, I'm Malissa Kissinger, public health nurse RN, and I do immunizations and disease surveillance here at Two Rivers.
Whether you're a seasoned public health nurse, a healthcare professional, a student aspiring to enter the field, or simply interested in learning more about the critical role of nursing in public health, this podcast is for you.
Welcome back, and thanks for tuning in. I'm Jacki Haley, and today we will be talking about a couple different Health Alert Network updates from CDC on tuberculosis, measles outbreaks, and dengue virus. And then the status of respiratory infections in Two Rivers District. And finally, our guest speaker today will be Malissa Kissinger, who will be educating us on Legionella. Okay, so updates on a couple different health alerts, and bear with me. These are long. There's a lot of information. I'm going to try to hit the highlights for you, but in the long run, it's always best to go and look up these health alerts and read them yourself, because I am not in no way hitting every single thing that you need to know. If you would like me to forward those to you, please let me know, because I can always do that. So first up, we have a Health Alert Network update on tuberculosis within Nebraska. So Nebraska's reported 34 tuberculosis cases in 2023, and provisional data shows about 41 tuberculosis cases in 2024. So although Nebraska maintains a low incidence for TB, the 41 cases do represent a 20-year high. And since early 2024, counties around Kansas City, Kansas, have been affected by TB outbreak. And as of January 31st, the Kansas Department of Health and Environment was reporting 67 patients. They also have identified latent TB, and there's about 79 patients with latent TB. So quite a big outbreak, and that is really close to us, so it is something that we should look at and consider. DHHS encourages patients with active TB disease to be managed by an infectious disease healthcare provider and the local health department. So we do case management and do direct observed therapy services. Next up, we have two health advisories on measles. So the first advisory goes over expanding measles outbreak in Texas and New Mexico and guidance for the upcoming travel season. Basically, guidance for the upcoming travel season, you want to make sure that if you're traveling, you either have evidence of immunity or you are getting up to date on your MMR vaccination. If you suspect as a clinician that they have measles, the key steps you need to do are isolate, adhere to airborne precautions, ensure your healthcare providers have immunity or they have what their vaccination status is, and immediately notify your local public health department about any suspected individuals. Also remember that lab confirmation should be pursued, and think about post-exposure prophylaxis for close contacts without evidence of immunity, and you want that within 72 hours of that close contact. The next measles advisory is on measles advisory increase in global and domestic measles cases and outbreaks. Basically, we want to ensure that children in the United States and those traveling internationally 6 months and older are current on their MMR vaccination. finally, our last health advisory for March 21st, 2025 is CDC on ongoing risk of dengue virus infections and updated testing recommendations for the United States. So this one is pretty short, but basically they want everybody to know that there is continued ongoing risk of the dengue virus infections, and activity remains high in parts of the United States and globally. And in 2024, Nebraska Department of Health and Human Services reported 10 dengue cases, and usually we report less than 5 cases annually. So since tracking began in 2003, the second highest number of dengue cases in Nebraska was reported in 2024. All cases were travel associated to dengue endemic regions, with 9 of the 10 cases reporting travels to area to Central America and the Caribbean. So while Nebraska does not have local dengue transmission, healthcare providers should consider dengue as a diagnosis for patients presenting with acute febrile illness and compatible travel history. Let's talk about what's happening in Two Rivers District. So we are currently in our respiratory season. Influenza A numbers have dropped significantly since a month previously. Yay! Hopefully we're on the decline, because that would be amazing. And, we're almost into April, so we want to see that decline. ILIs, or influenza-like infections, linked hospitalizations have also dropped, so that's great. There was a little bit of rise in the RSV cases, so we still need to be aware of that. And that's especially with young children and the elderly. COVID and flu B activity is minimal across Two Rivers District, so that's amazing. Loved seeing that. And flu cases seem to be on a slow decline across all 7 counties, so only time will tell to make sure that we are continuing to go in that downhill slide. So hopefully we're going to start getting some great weather. People are going to get outside, and we're going to have less of the respiratory season. All right, so now joining us is Malissa Kissinger, a public health nurse with Two Rivers Public Health Department, and she's here to talk with us about Legionnaires Disease. Hi, Melissa, how are you today?
Good morning. I'm fine. How are you, Jackie?
Good. So can you tell us, Melissa, what is Legionnaires Disease?
Well, Legionnaires' disease is a type of pneumonia caused by the Legionella bacteria, and it's spread through inhaling contaminated water droplets.
Oh, everything, it's all in these little droplets in the air, isn't it?
Yep.
So where does it come from?
The droplets most commonly come from shower heads, sink faucets, cooling towers, decorative fountains and water features, hot water tanks and heaters, large complex plumbing systems, and hot tubs. Occasionally, not very often, it can also grow in windshield wiper fluid tank of a vehicle.
Oh, interesting.
Which is more likely if the windshield wiper fluid is filled with just water instead of actual windshield cleaner
that
fluid.
Makes sense. Yeah. Mm-hmm.
Although it does occur naturally in freshwater environments like lakes and streams, it's usually in low amounts, and so that doesn't lead to disease. But it can't be transmitted from one infected person to another, so that's the good news with this one.
That is. But it sounds like anything that would make water evaporate into the air, like aerosolized or whatever, that's what we're looking at.
Yeah, and primarily water that's kind of still, you know. There are moving water features that do develop it, and
right, but not.
In fact, it was discovered from a moving water feature in a hotel.
Yes. Well, technically, it was an air conditioner, and the air. That's what it was from. Is the air conditioner.
Oh, I thought it was the water feature.
Nope. So the air conditioning system had, like, how it cools or whatever. And so this was back in like the 70s. Yeah. And so the air conditioner had condensation that built up, and so it had standing water that had built up in that air conditioner. And then when the air conditioner turned on and it blew past that water, then that's when it blew all of that and aerosolized.
Okay, that's right. They looked at the water feature at the hotel where the Legionnaires were staying.
Yes. Mm-hmm.
That's right. Now I'm remembering my Forensic Files episode.
Yes. It's a good episode. If you haven't watched it, you guys need to watch it.
Yes.
So who is at risk?
People who have chronic lung disease, such as asthma, COPD, smokers, older, I hate to give a number to this because I'm 50 plus, adults, people with cancer, diabetes, kidney failure, liver failure, people with weakened immune systems, and are at an increased risk if exposed to the bacteria. Of course, anything that causes your lungs to not be able to fight things off as easily is going to increase your risk.
Right. And obviously our Legionnaires. I mean, they were the ones that we figured out this whole new bug from. So, but that is the population. They were elderly and, they were all...
50 plus is not elderly. Let's back it up.
They were on the older end of the spectrum.
They were a little past middle age.
Yeah. But, they're also, they are servicemen.
Yes.
So they have damage to their lungs and, they have pre-existing conditions. And so that can make them more susceptible as well. So what are some factors that lead to the growth of the bacteria?
Like we said, the still standing water is where it's kind of allowed to grow. And that part of that is because it grows a biofilm or a slime that kind of grows over the top of the water.
Right.
And also the temperature can affect affect the growth. So
yeah, you got to have your water has to be hotter than 140 degrees. Mm-hmm. Yep. And there's a lot of people with people of advanced age.
That's a little better.
Or with, younger kids that they don't keep their water heaters at that top end because they don't want to cause burns. Mm-hmm. And so that can, enhance the chances.
Yes.
So what about symptoms? What are the symptoms and when do they occur?
So usually they start anywhere from 2 to 14 days after exposure. So, that's a pretty wide range, but they can include respiratory symptoms such as cough and shortness of breath. General symptoms would be fever, muscle aches, headache, or stomach symptoms like nausea, vomiting, diarrhea. So basically, this could mimic just about anything else.
Yep, it really can. And but we find everything that you can get from breathing in from aerosolized, whether it's a virus or Legionnaires disease, that seems like they all have the same symptoms.
Yes, they do.
So what about prevention? How can we prevent?
So properly maintaining any water systems, including cleaning and disinfecting. Avoid inhaling water mist from showers, cooling towers, managing your health conditions, quit smoking if you can.
Yeah.
Specific interventions for various at-risk water systems like potable water systems, cooling towers, hot tubs, decorative fountains are available on the CDC website. So if you have one of these things and you're like, oh, I wonder if this is part of it and how do I keep that clean, you can look that up on the CDC website.
There are a lot of things on prevention for water management. So what about diagnosis for Legionnaires?
Diagnosis is based on symptoms and a chest x-ray and blood and urine samples. So, yes.
As I do know, if you go into the ER, one way they'll do a urine test, and that's usually how they find it.
Yeah.
And to mention too, you could have Legionnaires disease, but you could also have Pontiac fever, which is caused by the same exact bug. Pontiac fever just is less deadly.
Right.
So So, what about treatment? Like, do we have treatment options or?
Well, most patients actually require hospitalization with Legionnaires disease. And some of that has to do with their already insulted
Comorbidities.
system.
Yeah.
But oxygen might be required if there's a decrease in oxygen levels. Severe cases, they may require a mechanical ventilation. But typically the antibiotics are ran for 10 to 14 days. More severe cases that may be extended to 21 days. So, the treatment in minor cases can be pretty simple. The problem is a lot of times it doesn't even get diagnosed until it's very debilitating. So
Yeah. And we kind of mentioned it before, but there was what was the case files? Is that what it was?
Forensic files.
Forensic files. There you go.
Yes.
So there is a forensic files episode specifically on Legionnaires, and it goes over everything. And it's actually really cool because it is like they're doing disease investigation from like start to finish on it. Yeah, very, very interesting. So if you guys that are listening, if you haven't went and watched that, one, you're going to feel like you're transported back in time.
I was just going to say, it is a little dated.
Yeah, because it's like you're back in like the 1990s, you know. So, you know, the video quality isn't high. But it is very interesting, and that is how they figured it out, was from that one gathering. So, but lots of information online, and the forensic files is a really good thing.
And probably why I don't remember the specifics of the forensic files is because I probably watched it when it originally came out.
Did. I can tell you, I know I did, because I remember when I was a kid, I watched forensic files, and then what was the other one? It had the guy, and they were mysteries, unsolved mysteries. Yes, and to this day, I could hear that guy's voice. And
one of my first memories of coming to Two Rivers was I walked past the boardroom, and there were nursing students in there watching the forensic files episode, and I'm like, oh, I know that voice.
Yeah.
So
and we do. Whenever we have nursing students here, we have them watch it because it not only is a great show to watch because you learn so much. It's really good for disease investigation because you can see it from like identifying to like looking into it to seeing that it's all in these one, set of people, and then they all just track it back to this one hotel.
Right. Yeah, and the epidemiology piece of that is fascinating.
It really is. Really is.
Yeah.
So yeah, if you guys have any questions, let us know. Lots of information online, but we are a wealth of knowledge as well, as you can tell. But thanks for joining us. And next time, I will be educating everyone about cat scratch fever. Anyways, along with medical updates and both nationwide and right here at home. So thanks, Melissa.
Thanks for joining us. Check back in with us next time for more of the Nurse Perspective.